All right, so welcome back. Today's topic, we're going to talk about merging. It'll be similar. We'll go through some slides and then we'll do a demo. You're welcome to follow along if you're logged on to MEDSIS training. We'll also be using training today. And after that, I will be going through some scenario on some frequently seen scenario that people are having trouble merging. So we'll go through those as well. Right. So let's move on. So first, why do duplicate exist in MEDSIS? So there are a couple of different reasons. First is because we have multiple reporting mechanisms in Arizona. So it's a dual reporting system. Lab has a list of reportable conditions that they need to meet, and healthcare facility also have a separate list. The two is very similar, but there are a few morbidity that's either only reportable for lab or only reportable for healthcare facility. And we also have a third list for childcare and daycare and long-term care. So that's a separate list. So that is why we have duplicates, because if you remember from last week, hospital or healthcare facility or laboratory who sign up to manually enter cases into MEDSIS, they can only see cases that was previously reported within their facility, which means that if the lab received the test from the provider and did the reporting, they'd report directly into MEDSIS, or it comes through ELR. Because the reporting facility is different, the provider who is reporting, they can't see that record that's already reported by the lab. So that's why we have duplicates. Secondly is, we also mentioned this last week, is that data entry users from the hospitals, from the healthcare facility side or laboratory, they cannot edit anything once they reported a case into MEDSIS. So a lot of times if they need to correct something, they need to either send a message to the MEDSIS help desk or send the information to their local health department to do the correction. I don't remember if I mentioned this, but if the hospital accidentally report a case under the wrong morbidity, there's nothing that we can do on our end either. If it's reported under the wrong morbidity and the morbidity is not part of the morbidity grouping, the users have to re-enter that case into MEDSIS. So you will end up with a case with the wrong morbidity and a new case. But it could be under a different user, different person record. In that case, you probably want to merge the person record. So there will also be merging happens for those scenarios. And lastly is users just didn't do the search broad enough in order to find the existing case that is already in the system. Yeah, so these are a few reasons why there are duplicates. So in order to clean up the data, we have a detour process called merging. So if you log on to MEDSIS, I don't know how many of you have merged a case or a person record in MEDSIS already, but there is a tab called Merge. And if you click on that tab, this is the screenshot on the slide is what you will see. If you remember, we mentioned that in MEDSIS, there are two layers of record. One is person record and one is case record. This also means that if you want to merge duplicate cases, first of all, you need to make sure that the two person record that's associated to the duplicate cases are either already under the same person record, or if it's not under the same person record, you need to merge the person record first before you can merge the duplicate cases. So that's why on the screen you will see there's a merge patient tab and there's a merge case tab. So if the duplicate that the system found, the eligible merges that the system found is that, oh, these two person record is potentially they should be the same, they'll be listed under the person merge patient. And if the two cases are already under the same person record, then those cases will be listed under merge cases. So you can skip the person merge step. So how does dedupe work? So eligible merges are updated on an hourly basis, and it's on the hour. What does this mean? This means that MEDSIS system runs every hour to try to find new eligible merges. So if, let's say, if there's two cases that I know they're duplicate, but maybe the name is off or the date of birth is off, I have to go in and make some changes so that the two person record or the two cases can be eligible for merging. I went into one of the cases to either add the aliases to the aliases table or correct what already exists in one of the cases. After I save it, let's say right now it's 112. I went in and corrected and save it, and I go directly into the merge screen. The duplicate cases won't show up because the job runs on hourly. So I have to wait until the next job runs, which is 2 o'clock. So after 2 o'clock job runs, and then I go back into the merge screen, the duplicate cases will show up on the cases screen, on the merge screen. And now I could go in and merge the case for the person record. And this is also, the timing is also very important because it'll make more sense once we did the demo. But when you've decided to go merge the two person record, after you go through the person record process, the system you have options. The system will either, you could either continue to see if there's any potential duplicate cases, or you could just merge the person record. However, if you decided to not look for any potential duplicate cases, and then later on you found out that, oh, there's actually a duplicate cases for this person record, you have to wait until the next hour the merge job runs. Then the duplicate cases will show up on the screen for you to merge. That's why it's important to know when the merge job runs. The other thing I want to mention is, so because the data volume that we're having with COVID is constantly increasing, the merge job can take a little bit. So I would usually suggest people to go in around 15, like on 15th of that hour, to make sure that the merge job already run is completed, and then you could go in and find your merges. So next I'm gonna start to talk about person merge, and then we'll jump into case merge. So how does the system find duplicate person record or potential duplicate person record? The system looks for 5 criteria: first name, middle name, last name, gender, and date of birth. So it looks for these 5 fields. And middle name, it looks for a middle initial. So if the middle initial, the first letter of the middle name and the middle initial match up, those are considered eligible for merging. And aliases is also included. So that is why it is always very important to add a name as an alias instead of correcting the primary name that's shown on the case card or on the top of the case edit screen. Yeah. So case records are eligible for merging regardless of the jurisdiction for the respective cases. However, at least one person record must be active in the user's jurisdiction. And this applies to ADHS as well. So let's say you identify two person records that needs to be merged, and both of them, you're under ADHS user role. But both of them are under Maricopa, currently under Maricopa County. You won't be able to merge them. It won't even show up on your ADHS merge string. So you'll have to either switch it over to Maricopa County, or you can wait until Maricopa County submit those cases and then merge it under ADHS. And if I identify two person record that I need to merge, one is currently under ADHS, which I am currently under ADHS user jurisdiction, and the other one is under Pima County. Because one of the person record is currently active under ADHS, I can merge those two person records. So on the handout, there is a table that shows the matching percentage. It kind of gives you an idea what does percentage mean and whether or not the duplicate is going to show up on the screen. So if all 5 fields matches up, it's 100%. So most of the time, if it's 100%, it's pretty likely that you could go ahead and merge it. If middle name is missing or there's a matchup, is 89%. I'm sorry, 98%. If middle name is missing and gender is also missing or mismatched, is a 95%. If date of birth or gender or middle name, at least one, if gender and date of birth, at least one is missing, then it's 80%. So most of the time, if it's 95 or under, we would suggest that you actually go into individual cases to make sure that they belong to the same person or the duplicate cases need to be merged before you actually perform the merging. I'm going to stop here real quick to see if anyone has any questions on person merge. Right. No question. We'll move on with case merge. So when multiple case record has been merged into one, a new case with a new MEDSIS ID is created. So it's like the image that's shown on the slide. Case A, I kind of use color to make it easier to understand. When case A and case B need to be merged, after the two are merged, MEDSIS actually create a new case called case C that has its own unique MEDSIS ID. So MEDSIS is not taking one of the cases and merge the other into that old one, but instead it's creating a brand new case. And after a case is merged, previous MEDSIS IDs as well as any existing local ID that are stored in the case previously will all be saved under the identification section. And users can search for the new merge case using the old MEDSIS ID. So any of the MEDSIS ID, you could search and bring up the new case. So next I want to talk about what are the criteria we are looking for a case merge. So on your slide or on your handout, there is a table. First is person record. Of course, cases must be under the same person record in order for you to merge them. Next is primary jurisdiction. So this is a little bit different. Person record, you only need at least one person record to be under your jurisdiction. However, for a case merge, both case or however many cases that you're planning to merge must be within the same jurisdiction. So if a case is currently under ADHS as the primary jurisdiction, and another case that you need to merge is under Pima County, the case won't show up. You can't find it on the merge case because one of the cases is not under ADHS. So what you need to do is either transfer the ADHS case back to Pima County and then merge the two cases under Pima County, or you can submit the Pima County cases back to ADHS and then merge the duplicate cases under ADHS jurisdiction. But you probably want, if you want to submit that case to ADHS, you probably want to check with the county and make sure that they're not currently working on that case. But yeah, but you do have to, both cases or however many cases that you're trying to merge, all they need to be under the same jurisdiction. Next is morbidity. So of course, morbidity has to match up. If the contact is linked to the same index case within one index case, you can merge them. However, if a contact is associated to an index case and the contact has a separate case, confirmed case that is separate, and you want to merge the contact with the individual case, you can't. The system will actually stop you from completing the merge because the morbidity doesn't match up. So what you have to do is you'll have to go into the contact and then update the morbidity from contact to an actual morbidity. And after that, you can merge the cases. You can merge the two cases. So the easiest way is always check and make sure that the two morbidity match up. Next is event date. So all the cases that you are eligible for merging must be within the merging time frame. So the merging time frame is usually the time frame that we use to determine how we count the case. So for example, for COVID, it's 90 days. If the two event date exceed 90 days, then the system won't even show those two duplicates as eligible merges. For TB, not TB. For cocci and hepatitis B, it's always. So there isn't a timeline on when you can merge or when you cannot, or when the system will stop you from merging. However, on top of the timeline that needs to be met, there's an additional criteria, which is at least one case must have an event date in the current year. So what does that mean? That means that, let's say, I identified that two cocci cases. One of them is in 2018, one of them was reported in 2019. It wasn't merged at the time during data closing. I have to merge them right now because both cases event date aren't in 2021 or 2022. Oh, sorry, 2021. So those two won't even show up on the screen for users to merge. What it means by at least one that is in current year, that means that, let's say a new case, 2021 case come in, one COVID case came in, and there was a 2020 case that that was reported in November 2020, and a new COVID case came in January 2021. It's within the 90 days for COVID. However, because the newer case has a event date of 2021, the two will be considered eligible for merging. So right now, everyone can merge all COVID cases because we haven't completed our data closing. Data closing usually happens around April and May, but because of COVID past 2 years, data closing actually got pushed to October and November. So that is why we haven't adjusted. And every year after data closing and after the previous year data has finalized, we will archive it, and then we will adjust the start date in MEDSIS to whichever date that current year's MNWR started. And after we adjust that date, the current year will then shift to whichever year that you're currently in. And any past cases is considered old cases. So it's considered not under current year. So let's say we actually have finalized our 2021 data. So once we got an okay from surveillance team, said that yes, we could go ahead and adjust the start date. Once we adjusted, if you later on found out that, oh, there are actually two 2020 COVID cases that need to be merged, that wasn't, because none of the cases has an event date under the current year, you can't merge them. There is an exception. So if you are approved to have the capability of doing accept merges, there is a separate tab that allows you to look up those old cases and merge those old cases. But those permissions are only given by request or by approval. So this is just to give you an idea. This slide, also on your handout, there are a few examples that showing you some of the morbidity and what their timeline looks like. You don't need to memorize every single timeline for each morbidity. MEDSIS already automatically calculated for you, but if you're interested, here are some examples. If you want to see the full list, you could go to the MEDSIS user guide, and under appendix, it has a full list of morbidity and their merge timeline. So now we kind of go through how MEDSIS, the system, look for eligible merges, eligible person merge, and eligible case merge. Next, we're going to talk about how the system do the merge. So we have two ways. One is what we call wizard. Wizard is data merged by the wizard allows users to select data throughout the process. So users can actually go in and pick and choose the information that you want to keep or you want to display. Auto merge, on the other hand, is any section that are auto merge, the system will do the merge on the back end. So you don't see how that was done. So there are a few logic that is good to know. Is first, all the date fields are always default to the earliest date. And all the single field like race, ethnicity, after you merge a case, it is always default to the less updated record or field. And if it's a drop down, let's say, yeah, if it's a drop down, known valid response will always trump blank. So even if one race is, let's say one of the races is white and the other is blank, and the other one is newer, but because the newer case is the race is blank, so the system will always take a valid answer to a blank. So even though the newer case is blank, the system will still take white and populate it into the merge case. So the part, and for any table that is within a case, it just combine the MEDSIS just combine the two tables. So you're not going to lose anything if it's a table. One thing that we definitely want you to be careful with is DSO, because there's a lot of single fields in the DSO. Let's say more expect field. There's other like contact, if you have any contact, with what type of contact you had. So there are a lot of single drop-down lists in DSO. And how MEDSIS merge cases is, like I said, it always default to the most recently updated field. So if, let's say, if case A is an older case that has a more complete DSO, and case B is a newer case that the DSO was not complete, when you merge them, because case B has a newer saved DSO, when you merge them, case B DSO is going to overwrite case A DSO. So the merge case will have case B DSO. If there's conflicting data, the merge case will take whatever's in the case B DSO. That's why we always suggest that people, if you identify duplicate cases, mark the other duplicate cases as not a case. So everyone who will be working on that case know that to only work on one of the cases. This way you can prevent data loss. Or you could also go into each individual case and resave the DSO before you merge it. So that way you can ensure that the DSO that you want to keep has the most recently updated save date associated. And lastly, if it's a free text, it will just combine the two entry with a semicolon. So now you have an idea how MEDSIS merge the data. This is just an idea, give you an idea which section, how MEDSIS treat each section. So for person record, most of them are wizard, which means that user can actually go in and choose what information they want to keep. And alias is a table, so it just automatically combine the two. So case merge is a little bit different. A majority of the section that case merge do during merging are auto merge. So it'll just combine them on the back end. And a few of them are wizard, which means that users can go in and manually select the information that you want to keep. Next, we want to talk about decision making. So not all eligible merges that is showing on the screen should be merged. First, and there are scenarios where you have to make a call which information that you want to keep, or if you actually need to merge those two cases. So first, we'll start with deciding which information to pick and choose for the merge case. So for names, we usually go with the name that you identify as the primary. And any name combination that wasn't selected will automatically get saved into the aliases table. So we're not going to lose any name combination. It will just be saved as the alias table. So you only need to decide what names will be displayed on the case card and in the extract. Secondary, if the address, if there are multiple different address, we usually go with the earliest reported address. If it's the most complete address, if the first reported address is the complete address, we'll always go with the earliest. Because the primary address is, the definition for primary address is the location that they were found at time of illness. So yeah, so that's how you determine if the jurisdiction is different. That's how you determine which address should be selected as the primary address for that case. And most of the time, you don't need to adjust any date reported. We always just leave it to the earliest as the default to the earliest. The other thing I want to mention is classification. So I kind of mentioned it last week. This is the only time that ADHS will be touching local classification is if you're doing a merge and it turned out that the local classification, there's a mismatch between the two local classification. You need to go in and make the call which classification to keep so that you can move on with the merge. So that's like the process, how you decide what to keep, what to choose for the merge case. The other decision that you need to make is whether you should even merge the duplicate cases that is showing up. Because not all eligible merges should be merged, especially if there are the same morbidity but with a different stereotype or with a different type. So let's use flu, for example. The system show there are 2 duplicate flu cases that needs to be merged. But if you actually go into individual cases, case A is actually flu A and case B is actually flu B. You probably don't want to merge them because they should be counted as separate flu cases because the type is different. So that's why we always recommend people to double check before you actually merge. And unfortunately, there isn't a way to see, at least right now, there isn't a way to view what the more expect field is for each case. So you do need to go into the case. You need to actually open up the case and check and then merge. Next, I want to talk about outbreak module link case merge. So I'll quickly go through this. We'll talk a little bit more about outbreak module on our 4th session. But if the duplicate cases is associated with outbreak, you are able to merge them. However, if the duplicate cases are associated to a different outbreak, they won't show up as eligible merges. So the duplicate cases need to be either under the same outbreak, or you have to link the outbreak, merge them, and then link the merge case back to the correct outbreak. And we'll talk about this a little bit more, but within the case, there's actually 3 options for outbreak status. One is no, it's not an outbreak. One is yes, OBM, which is yes, it's an outbreak, and the outbreak is in the outbreak module. And the other one is yes, non-OBM. So yes, but the outbreak is not part of the outbreak module. So the system only checks if 2 cases are linked to different outbreak, those won't show up. But if a case outbreak status is yes, non-outbreak, and the other case is actually linked to an outbreak in the outbreak module, this is what you will see is that you have to choose which outbreak to keep for the merge case. And we'll also touch on this when we talked about outbreak module, but every case that is associated to an outbreak, the system automatically creates a short form that is associated to that case. And so, which means that if you're merging two cases into one, you have to decide which short form to keep. And whichever short form that was not selected will be attached automatically as a PDF in the attachment section for that merge case. Yeah, so those are the things that you need to know when you merge a person record or a case. Next, let's talk about, okay, I merged a case. And then I figured out, oh, the merge case that the merging that I just did, they shouldn't be merged. They're actually, let's say they have a different stereotype. They shouldn't be merged. They should be counted as separate cases. There is a way to roll back. So users have the option to roll back, which is the third tab that you see on the merge screen. And when you perform rollback, you're actually reactivating the original record or original case. And case will be in their original state, which means that any additional information that you add to the merge case will no longer exist after you roll back the case. So any data that you entered will be lost. So in order to avoid loss of data, it is recommended that if you identify it right away, roll it back right away. And that's also why, because multiple people can work on the same case at a time, so a lot of people can add additional information into the merge case after the merging is complete. In order to not lose any important data, we have a timeline for how long after a merge has happened that the system will allow users to roll back. And the timeline is 3 months. So after 3 months, there's just too much information that has been put into that merge case. So it doesn't make sense to roll them back. So if it's past 3 months, users can't roll it back. We can't roll it back. What you have to do is you have to manually enter that, split them out into 2 cases. So you have to manually enter it as a new case and move whatever information that should be split from that merge case. You have to manually move those information out. The other thing is, if you don't feel comfortable performing rollback, you can also always email the MEDSIS help desk, and we could help you out. We could roll that back for you. It's also not easy to find the merges that you need to roll back. So if you ever run into trouble or if you just don't feel comfortable, you can always reach out to the MEDSIS help desk and we'll roll back those cases for you. Next, I want to talk about how do you determine the counting county. So because ADHS do perform merges on submitted cases, so we will definitely run into a scenario where 2 cases were submitted by different jurisdiction, and then we need to decide which jurisdiction that merged case should be listed, which jurisdiction that merge case should be listed under, what we usually do is we will go with the patient primary address. And whichever county that patient primary address is under, we'll select that as the primary jurisdiction. And non-selected jurisdiction will receive an automatically shared of that new merge case. So the jurisdiction will still be able to see the case, but they'll lost edit rights to that case. So if you work with data, and if you will be working with data in the MEDSIS extract, we will talk a little bit more on Thursday, but on MEDSIS, within MEDSIS extract, there are a few column or few variables that you could use to determine whether this is a merge case or not. And on this handout, there is a table that lists out those fields. So just for your reference. Next. So that's all the slide I have. Any questions before we jump into demo? All right. So if you want to follow along, you're welcome to. Log on to MEDSIS, and let's go to the merge tab. So on the merge screen, here you can see it actually show you like if the merge job is currently running or not. It shows complete, means that it's not running. And underneath, it will actually show you when is the last time the merge job runs. So it actually ran at 1, and the next time it's going to run is at 2. This button is only a few people has it. I have it. Laura Earhart has it. So this actually allows us to force the merge job to run. And because every time the merge job runs, the system will be triggered and run a lot of the things on the back end. So we don't want to have multiple people have this access and start pushing the button at the same time or back to back, which will lead to potential system confusion. So that's why only very few people has that. But anytime if you need to merge the case right away, like you actually have to have it done right away, let me know. I could push the button for you. There is an option that you could click on to see why your case is not showing up. Sometimes you can tell by the error message. Sometimes it's kind of hard to understand, or it doesn't really tell you clearly why you can't merge them or why they aren't showing up. You can use this as a way to find the reason. Or you could also just send an email to the MEDSIS help desk, include the MEDSIS ID, all the MEDSIS IDs that you're trying to merge, and we could figure it out on our end. But yeah, then now I'm going to jump into the different tabs. So merge patient, you can see that we're currently in training. Because the middle name is missing, the date of birth doesn't match up. It's either the date of birth doesn't match up or the gender doesn't match up. So it's 80%. Let's see if there's any other one. Okay. So for example, you will see that, oh, the name doesn't match up. What is 100%? This is due to aliases. So one of the name was actually added to the other person record as an alias. So that is why it is considered 100%, because aliases, when the system do duplicate eligible merges or duplicate. It always takes aliases into account. Yeah, so this is, for example, middle name is missing and date of birth is missing, so it's 80%. This one, because gender is the mismatch, or if gender is missing, it will be 95%. Yeah, so that is kind of how merging works. So now I'm going to perform a merging. I'm going to merge my Amy line and test sample. So I'll just go ahead and click on merge group. And you could, if you're on training, you could pick whichever that is available and follow along. But yeah, you need at least 2. You need to select at least 2 to move forward. So you just like click through. The system will take you through different steps. So here is where what we call wizard is where you could actually go in and select the name that you want to keep. So I'm going to keep it as Amy Line, and it's a female. So after you select it, whichever information that show up underneath, it will be whatever name that will show on the case card and as the primary name for that merge case. So you could just move forward. If there's any conflicting data or you don't want the default, you could go in and select the information you want to keep. For address, we usually don't recommend people to remove any address because we don't want to lose anything. So we usually just tell people to continue. And if there's work address, you'll do the same. Phone number, cell phone. No, that's not a phone number. Yeah, so insurance, if there's insurance information, it will show up here. There isn't for these cases. So these cases are all the cases that has one of the person record that I'm about to merge. So that's why it lists out all the cases. Yeah, so at the end, it'll give you a preview, and where you can make sure that all the information that's shown on the screen are the information that you want to keep or you want it to show on the merge screen. So here you have 4 different options. If you notice that, oh, there's something wrong, you can go click previous to go back to fix it. Or you could click on next, which after you click on next, it will prompt the system to automatically do a search on whether there's any eligible merges. If you click on finish, then the system will just go ahead and merge the duplicate person record. And that's when the scenario that I just mentioned will happen is if I go ahead and click on finish, and then later on I notice that, oh, there's actually duplicate cases I need to merge. I need to wait until the next hour the system reruns so that the system will do another eligible search and bring the duplicate cases up and list it under merge case. And then I could go in and merge them. So we always, or you could, if you decided not to merge, you could just cancel it out. So we always encourage people to just go ahead and click on next because it doesn't hurt anything to prompt the system to do another search. So if there's if there is eligible merges, this is what it will look like. It will show up. It will show up like, okay, there are potential duplicates if you do want to go ahead and merge them. Yeah. So I'm going to, let's say, yeah, let's go ahead and merge them. It is showing these 2 are 2019 cases. These are showing up because we have different, so we're not that strict on, we don't have a lot of the logic that we have in production to prevent people from merging things that they shouldn't. We are less strict in training, and that's why it's showing up. I'm going to go ahead and merge these two because since it's potential duplicate, I will. So it's similar. It will just take you through the same process. If the onset date is different, you could go in and select the one, or this is actually not the right onset date, you could just select blank, so the merge case will show blank. Yeah, it would just take you through each steps. And here is where you want to be careful, and this is also where you will need to make decision which address you want to mark it as the primary address. So we usually go with the earliest reported, so it's usually called cleanup count. But let's say we know that I know that this is a tribal case. And I know that this person, no, actually, yeah, I know that this person actually lives on tribal land, which is San Carlos Apache. I will use this as, I will mark this as the primary address for this case. But if I actually know that they're in Maricopa, but we don't know the address, but because there is one address that has a complete address, we will go with the complete address. But you do have to pick one to be the primary address to mark as the primary address for the merge case. Yeah, so it will be the same for work if you have work address, insurance. Yeah, so the last step is the same. You can preview what you've selected. You have the option to go back or cancel or click on finish. So after you click on finish, underneath you'll see a new row or a string of text. It says merge case and give you the new MEDSIS ID. So if you click into the new MEDSIS ID, click on the new MEDSIS ID, it will bring you into the merge case. And any name that wasn't selected will be listed under aliases. And because I select the most complete address as a primary, so this was marked as the primary address. Under identification, you can see that both MEDSIS ID are listed under the identification table. So if I go ahead and copy this MEDSIS ID and go into search and search for this MEDSIS ID, it's going to bring up the case that I just merged. So yeah, so you can search by any previously associated MEDSIS ID or the new MEDSIS ID. The other way you could tell that this is merged is under comment. So it will actually automatically add a row to the comment section that show you merge from cases that list out all the MEDSIS ID. Yeah, so that's what it looks like after you merge a case. What about, so if you can't find the person record under person merge per patient, always just go in straight into the merge case tab and try to see if they're already under the same person record. So if they're actually listed under the case merge case tab. And it's the same process. Oh, I think someone merged that one. So you have to refresh. If someone already merged it, it won't allow you to merge them. And the other thing I want to mention is if if someone is, so in MEDSIS, we limit it to only one person can be in a case at one time. So if someone has a case open, currently open, and I'm trying to merge a case, the system is not going to allow you to complete the merge because someone is in there. There's a possibility that they're making changes to the case. In order to avoid data loss, MEDSIS is not going to allow you to merge them. And it's the same. If someone is currently in that case, had that case open, if you go in after them, even if it's under the same jurisdiction, you can't edit that case. It won't allow you to make any edits. Yeah, so I'm just doing another merge. This is a case merge. So here you can see any dates is always default to the earliest. So date reported to county, because the September one is the earlier one, so it default to it. Well, let's say we actually want it to be November, today's date. I could go in and select that. Most of the address is the same, so finish, and then yeah, and then I merge another case. So I probably should have shown you beforehand, but before I merge, there's one of the cases actually has 2 contacts and the other case has 1 contact associated. But because I merged the 2 together, all the contact that was associated to under those cases will get combined into and will automatically associate back to the merged case. However, you can see that there is a Joe index, and this is also a Joe index. Let's say that these 2 actually are the same person. His 2-person record are actually for the same person, and they should be merged. These 2 cases should be merged because this contact is linked as a child to the parent. You can't merge them unless you break the linkage. So you have to break the linkage for this contact. After you break the linkage, you can merge this case to this index case. Yeah. So that's what I'm going to jump into right now, is to go through all the different scenarios. Any questions? All right. Before I start talking about the different scenario, I want to talk about auto merge. So auto merge runs. We have auto merge that's running behind the scene. It was implemented around, I think, around June or July last year, 2020. So auto merge run on a daily basis, and it comes in, it runs as a pair, because the first time it runs, if it's a potential duplicate person record with a potential duplicate case, the first merge job will pick up the duplicate person record and merge the person record. And the second job will then pick up the duplicate case record after a person record is merged. So that is why auto merge is also run. It's always run in pairs. It runs at 9:30, 10:30, 3:30, 4:30, and 9:30 and 10:30. Currently, only flu, RSV, COXI, and COVID are eligible for auto merge. And duplicates needing both a person, patient, and case merge required. So which means that if patient A and patient B, they're the same patient record that needs to be merged. Patient A has a COVID case. Patient B only has a flu case. because their cases aren't duplicate, there aren't duplicate cases that's associated with both person record, they're not eligible for auto merge. They are eligible for manual merge, which you can manually go into the merge screen and merge patient A and patient B record, but they won't be picked up for auto merge because they don't have duplicate cases. And this is just a preview. So for auto merge, the other criteria is the person record needs to be 98% matches, 98% or more matches for it to be eligible for merging. So if the person's 95 or lower than 98, those won't get picked up by auto merge either. Those will have to be manually merged. So this is kind of what I was talking about is person A. So the second scenario, person A has a COVID, person B has a flu. Because there's no duplicate for either flu or COVID, they're not eligible for person merge. However, scenario 3, because person A has both one flu and one COVID, and person B has a COVID, the 2 COVID cases are duplicate. So that actually meet the criteria for auto merge, for person merge. So those will be merged when the auto merge runs. So for auto merge for case records, it excludes any information, any cases or person record that has insurance information or are associated to an outbreak in the outbreak module. So if the record has insurance or if the record was associated to outbreak, you'll have to manually merge the person record and the case, and not the person record, sorry. You'll have to manually merge the duplicate cases. So what if there's conflicting data? Because auto merge is automatically happen, so users can go in and decide which to choose from, which to keep. So there is an algorithm. The valid answer will always override unknown or blank for all fields. And for date field, it's always default to the earliest date. Single field that has conflicting data will always be default to the most recently updated information. So for example, one case has a state classification as confirmed. The other one has a suspect. The suspect one was the later reported one. When auto merge happened, the state classification will take the suspect classification and not the confirmed. No, actually, I lied. Classification is a bad example. We actually have a hierarchy for classification. Classification is confirm will always trump, probable will always trump suspect, and unknown and blank. Yeah. And by national field, will always take Mexico or Canada, trump, unknown, trump, blank. If Mexico or Canada, if the conflict is Mexico and Canada, then it will take the most recently updated information. So if Mexico was most recently safe, then once cases were merged through auto merge, it will, by national field, will then auto populate with Mexico and not Canada. And all this information is in the handout that's attached to the training slide, to the training invite. So last slide, I'm just going to go through different steps that you can take if you can't find your patient or cases. So first, you always want to make sure that first name, last name, middle name, that's associated with the cases match. If it doesn't, add a MEDSIS to the MEDSIS table. You do need to wait until the next merge job runs for it to show up. It's the same with date of birth and gender. Secondly, if you have to make sure that, yeah, the name match up. Secondly, check whether both cases are under the same jurisdiction, or if you're only merging the person record, make sure that both person record is, at least one person record is under your jurisdiction. If that one's also checked and that's also showing as what it's supposed to be, then check the event date. Whether if you need to change the event date for so that you could force the event date, change any of the date that is available, so you can force the event date to recalculate to match with the merge timeline. Next is make sure that you check in the person. If you are just looking for duplicate cases, make sure you check the person merge screen first and make sure that cases are already under the person record or not. If not, you want to merge the person record first and then merge the case. And lastly is just double check when is the last time the dedupe job runs, and if any changes were made after the dedupe job, you probably want to wait until the next hour. And if you actually went through all these steps and checked and everything is showing as what it's supposed to, go ahead and email the MEDSIS help desk, and we will help you figure it out why they're not showing up. Okay. So now I'm going to jump into some scenarios that most people run into and have trouble with. We'll start with timeline, and this mostly happened to COVID cases. The reason why we have this issue is because with COVID and lab reporting for COVID, they're actually mandatory to report both negative and positive. And beginning of 2020, or until the end of 2020, we have been processing negative lab tests in either attached to an existing case or create a case if there was previously reported positive tests of confirmed cases within MEDSIS. So that actually leads to creating a lot of cases that has a negative test. However, when we merge cases, we're basically deduping so that we could correctly count those cases. So if the case has a negative result, like case B, and there is a positive result, that's case A, we want to only count this as one. So we definitely want to merge these two. So what you have to do is you have to force the recalculate of event date. So most of the time, if one of the date is blank, like if onset date is blank or diagnosis is blank under the newer case, so you have to go into the newer case and check if one of the data is blank, take whatever date that is in the old case and fill it out in the new case. So in this scenario, because the diagnosis date is blank, so we're going to take the diagnosis date for case B, which is March 1st, 2020, and enter it into case A. And once it's saved, the event date will automatically recalculate to March 1st, 2020. And now the two event date is now within 90 days. So you could go ahead and merge them. So those will now be eligible for merging. So next example is what if all 4 days are filled out? What do you do? Because if you remember the logic for case merge, it is always default to the earliest state. So you could either go ahead and update the onset date for the newer case, case A, or update the diagnosis date for the newer case. It really depends on the morbidity, how we're calculating the morbidity. So you do have to make that call, which date is the better one to update to. But anyway, after you update the event onset date or diagnosis date, it will force the system to recalculate event date. So now you will be able to merge these two. Yeah, so please submit requests to a MEDSIS help desk if the system stops you from updating the diagnosis date or onset date because of date reported to ADHS field. This information is more for the local jurisdiction because they can't change the date report to ADHS. So we have to help them change it. But for you guys, since you're on ADHS, you can make those changes. But if you are not sure, it's the same. You could always just email the MEDSIS help desk. You could also CC me if you want to. But yeah. So those are the two scenarios that most people run into with dates. Next, I'm going to talk about contact linkage. So this is also a scenario where a lot of people run into issue with is contact. First of all, I want to talk about how contact linkage structure looks like in MEDSIS, what contact linkage structure looks like in MEDSIS. So in MEDSIS, contact linkage can only be in one direction. And the same logic applies to case merging. So you can see that case C can have more than one contact link, but the two other scenarios that's shown where contact has two index case or a case is linked, has a contact, and then the contact will be linked back to the case as an index case. These two scenarios cannot happen because you could only go in one direction. And this one goes in circle. And one contact can only have one index case. So this also doesn't work. So when merging a case and a contact morbidity needs to be updated to match with the index case morbidity. I kind of touched on that already. And to remove or reassociate contacts or contact linkage, you need to submit an email to the MEDSIS help desk with the index case MEDSIS ID, contact MEDSIS ID, and the preferred exposure path if you would like to reassociate and not remove. So this is a tip. So when deciding contact linkage, think about it how the merge case should be associated to another case. So it's easier to make decision if you can think of like, okay, after I merge this case, how should this case be linked to or linked back to, or another contact should be linked back to the merge case? Yeah. So next, I actually don't know why the arrow is a little bit weird. It should go downward. So we'll start with this scenario. If we have two contacts, if duplicate cases are associated with the same index case, duplicate cases can be merged without any modification. So you can merge contact A and contact B without changing anything. If duplicate contacts are associated with different index case, like this, for example, and contact A and contact B are duplicates, so you have two options. One is to break all the contact linkage. If you break all the contact linkage, well, sorry, let's do redirect first. First is you reassociate contact A to case D. So you break the linkage between case A and case C and contact A, and reassociate case A back to reassociate contact A, back to case D. And because now the two contact is now under the same index case, you can go ahead and merge them. Or you could break the two contact linkage, and before you break the two, or before you come to us to ask us to break the contact linkage, you have to change the morbidity, the contact to actual morbidity, so we could break it. The reason why is because contact cannot be orphaned in the system. So if the case morbidity is a contact, it always needs to have an index case. It can't live alone as a contact in MEDSIS. Okay, next scenario, we're merging cases and case and case. So if duplicate cases are linked to different index case, what do? Can you go ahead and merge the two case A and case B? Do you think you can merge the two? Anyone knows if you can, cannot? Yes, no? No one knows?
Say no.
Yeah, the answer is no. Because once you merge these two, you will end up with the merge case having two index case. And that path is not allowed in MEDSIS. So you have to either break the two contact linkage or reassociate one of the case that is associated to an index case to another index case. Yeah. Okay, next scenario. If both cases are linked to different contacts, can you merge these without making any changes? So we're merging case A and case B now. Case A has a contact, case C, yes. So yeah, Aubrey, you're right. You can go ahead and merge them because index case can have multiple contact links. So you shouldn't have a problem merging these two. Next scenario, if duplicate contacts are linked to the same case as different direction. So case A and case B are duplicate, but case A is case C's index case, and case C is case B's index case. Can you merge case A and then case B?
No.
Right, the answer is no. Because if you merge these two together, then it will be in a circle, and that's also not allowed in MEDSIS. So what do you have to do? You have to unassociate both linkage, merge the two, case A and case B, and then either link it back to case C as an index case or as a contact to case C. All right, next, if you are merging a case and a contact. So this scenario, if there's two scenarios on this screen. I'll talk about the one on the left first. So if you have case A and a contact B, you can merge them. However, you need to change the contact morbidity to an actual morbidity that match with case A. So the two morbidity match up. Second scenario, if both contact and case A and contact B are associated to case C as a contact, it's the same. You could go ahead and merge them, but before you merge them, you do need to fix the contact morbidity so the two morbidity match up. So the idea is the morbidity always need to match up. So next, we're merging a contact that is associated to a case and a case that is associated to a contact. So if duplicate case and contact are linked to different cases or contact in a different direction. So case A is the index case for contact or / case C. Case D is the index for contact A. Contact A and case A are duplicates, and you want to merge these two. Can we merge these without any modification? No. Do we need to break any linkage? Correct, yeah. Aubrey, you're right. We don't need to break any linkage because it's going in one direction, which meets MEDSIS structure, contact linkage structure. So yeah, so these are the few solutions that you could take. You could either just keep the linkage and then merge them, or you can, but before you merge them, you do need to update the morbidity. So you need to update contact A morbidity so that you can merge the two together. Or if this just gets too complicated by trying to figure out if the linkage works, you can also just break all the contact linkage or ask them to break all the contact linkage. And then after you merge a case, you could work on linking them back. Sorry. So this is a similar scenario of the one that we just went through. If case A is the index case for case C and case D is the index case for contact A and case A are duplicate. Can you merge them without modification? Correct. The answer is no, because it's going to go in a circle again. So this is your option. You could either break the first linkage, change the contact morbidity, and merge the case so that the contact, so that case A the merge case will be listed or be linked as a contact to case C. Or you could break the second linkage and change the morbidity so this way you can make case A or the merge case the index case for case C. Or you could break both linkage and you'll end up with two separate standalone cases. And yeah, and that is all the different scenarios. These are all the scenarios that a lot of people ran into and having issue trying to figure out why they're not showing up or why the system is not allowing them to merge. Yeah, so just went through that. Any questions? And all the scenarios are also listed on the one pager. No, I don't think it's one pager, but the handout that was attached to the calendar invite. But yeah, so that's merging. Any questions?
You're at time as well.
All right. If no one has any questions, I'm glad you guys find this helpful. But okay, cool. Yeah, if you don't have any questions, like always, I know this is a lot and you're probably not going to remember every single things we went through today. That's fine. You can always email MEDSIS Help Desk or email me if you run into any issue, and we'll work with you to figure it out. All right, then I think we're on time. So I'm going to go ahead and close out today's training, and I'll see you all Thursday.